Hi guys, welcome to LDFS. I'm Dr. Lakshmy. We are discussing COVID special series by LDFS. In my earlier videos, we have discussed about two major things. One was how to reduce your rent during COVID times, and second was the emergency fund and everything about emergency fund, like how to create, how much to keep aside, why do we need it, pros and cons, everything about it. So if you have not watched those videos, you can watch our channel. All the videos are available there. You can watch that so that you get benefit maximum from this. In today's video, we'll be discussing about how to attract patients during COVID. But before proceeding further, kindly like and subscribe us and share with maximum dentists as many as possible, especially juniors who have just started the clinic or are starting the clinic. Please share it with them so that they'll benefit the maximum from such videos. Thank you so much in advance for doing it. Before proceeding further, let's first understand why are the patients not visiting clinic? Why are they not doing the treatment right now? Why are they avoiding it? So there are two major reasons. There may be many. I'm just discussing two major reasons. One is usually they are afraid that the other patients who are visiting the clinic, they may be positive, and then there's an increased risk of them becoming COVID positive. That is one reason. Second reason is they are afraid to do the treatment. They don't know whether it is sterilized, has it been used to earlier patient, and has it been sterilized nicely, is the treatment room sterilized, the chair, everything. So they prefer to just postpone the treatment until it is, sorry, that was my kid, until it is necessary. So these are the two reasons why you should why the patients are avoiding to do the treatment in your clinic, in our clinic. Now let's understand what can we do about this. They have this worry. Now we know that they have these two worries. What can we do about it? But let me share a personal example with you. During the first wave, my daughter had some vaccination to be done. I was afraid to take her to the hospital at that time because I felt that there will be so many patients there. I don't know whether it's safe to go right now, whether they are positive or not. So I thought, okay, I'll take her to the pediatrician to whom I was always, her usual pediatrician who was. But I was afraid about that also because that pediatrician had so much rush, and usually the wait period was around 1 to 2 hours. So I thought, is it safe? I was very hesitant. I was very afraid. I was very hesitant to take her. So I thought of postponing the vaccination for some months. After a few months, I again started thinking about it, that okay, the vaccination is pending, what to do. Now, to remind you, during this time I was working in my clinic, I was doing patients, but I wasn't worried much about it because I was taking all the necessary precautions. I was after coming home also, I was making sure that I'm not touching her until I am clean and all. But still, I know there is chance that we can contract coronavirus. But still, I was little positive about it. I wasn't so much worried. But taking her to the clinic where it's crowded, I was worried about it. So what I did was, I thought, okay, just by sitting like this or thinking doesn't solve the problem. I need to take that vaccination. So I thought of calling up the pediatrician clinic and ask them about what are the protocols they are following, how is it, and everything about it. So when I called them, I came to know that they are only treating those patients who are requiring vaccination. Rest all cases where there is some fever or anything else, any other symptoms, they are doing an online consultation. That was the first thing. Second thing was the waiting area was also like there's no waiting, zero waiting. So the appointments were scheduled like that. So that was the second benefit. So And then I had a chat with the pediatrician also, and she also helped me in a lot of ways to understand the sterilization protocols which they are following. And then I was little tension free, and then I brought my daughter to the clinic and took the vaccination. Now this whole story, or this whole phase which I went through, I am pretty sure that majority of our patients are going through the same kind of dilemma. Kindly comment below and tell us that how many of you have gone through this dilemma. Many of you must have had to visit some other clinic or hospital for some reasons, for your daughter, for your son, for your parents or spouse. I would like to know what was your dilemma when you wanted to take them to that hospital or a clinic. Kindly comment below and let us know about your feedback. So the same scenario happens with patients. Now, think from the patient point of view. I am being a medico, I could understand the protocols which they were following. But being a non-medico, imagine the tension which the patients will be having, the worries they will be having. They may have some wrong information, they may have some right information, but they are worried about all the things, and they don't know the sterilization protocols, which is right, which is wrong, and the PPE kit and all. They don't know much details about it. Being a medico, we know, but they don't know. So they are also worried similarly. They are also having the similar kind of dilemma which we are having. Now, how to target that and how to help them in this dilemma or during this difficult times? One of the easiest way to show is through a video. Create a video where you can explain these things to them. It need not be a 10 minutes video or even 5 minutes video. It can be a 2 minutes or 3 minutes video. You can just shoot like how it will be when a patient comes to your clinic. What happens? How are they treated? What are the protocols you are following? What are the sterilization protocols you are following in your clinic? What happens in your waiting area? How are the appointments scheduled? Everything, the treatment, the PPE kits you are wearing, the sterilization of instruments, what happens after every patient goes. You can create one video, or you can create 10 videos about small things, and then upload it in your all online handles, websites, your Google my business page, your Facebook page. Send it on WhatsApp to all your patients. Everywhere, wherever you can add this, add it to the online platform, so that many of the people who are searching that where to visit, how to visit, they will get to know, they will see these videos, and they will have more confidence of coming to your clinic. Imagine one patient is there, he has two clinics nearby, one is your clinic and one is somebody else's clinic, and imagine you have just written in the online platform that you are COVID safe, but the other clinic, they have released a lot of videos where they are showing how the patient is treated. They are showing a lot of photos, they are showing the instruments which they are using, they are showing the sterilization protocols and everything. From the patient point of view, he will be more confident in visiting the other clinic than yours, because they are showing what it will be when he will visit the clinic. When the people see something, they believe more rather than just reading about it. So it's always important to show them what do you mean by COVID safe. Just saying COVID safe, they may not believe you. So by showing them to them, you can click photos, you can upload in Instagram, everywhere, whichever online handle you are using, you can just upload it there, so that it will reach maximum patients. And don't forget to send these videos to your earlier patients also, especially the loyal patients. Send them those videos. They will definitely come if some problem is there, and also they will recommend your clinic to others who are inquiring about some problem in teeth and what to do and which clinic to visit and all. So that these things help. Now you can create this video as a series of videos or small videos, or it can be different images and you have clubbed together in a small video. That is also a different ways of creating these videos. People will believe more when they see things rather than when they just hear about it or read about it. So these videos will help us reduce the dilemma of our patients who are deciding whether to visit our clinic or not. So I hope you like today's videos, and there are easy ways of creating such videos. In my next video, we will be discussing about how we can create it for free. Such videos which looks very professional, but it's very easy to create. I hope you like today's video. Kindly like, share and subscribe, and send us a hi on this number. We'll add you to the special broadcast list. Until next time, bye.